So a quick rules video for the emergency medicine edition of Empiric. You're going to see these are a little simplified from the rules for the pediatric version, and these rules I'm going to explain can be used for either edition. In the box are the antibiotic cards. Each of these cards says mechanism of action, route of administration, metronidazole can be oral or IV, a little details about spectrum of activity, and little icons representing important pathogens, in this case anaerobes. There are rules cards. On the white side is actually how you play, and you can just look at these. The white side of the cards is all you need to get started. On the back, on the blue side, there's a little more detail about each of the cards and how each of the cards work. And then the cases, all of these cards will have a number of points scored. Cellulitis scores only 2. The type of drug we're looking for, oral antibiotic here. And in the bottom corner right here is a number indicating which set it participates in. So this card participates in set 1 and set 3, but not in set 2. On the back, you're going to see the guideline-based treatment. In this case, penicillin, cephalexin, and Clinda are options, as well as a card number, and you can look up the references online using that card number at empiricgame.com. And at the bottom there is the list of pathogens that are commonly cause that kind of clinical situation. So to play the game, we'll set up for a 2-player game. So we're going to use card set 1. We're going to pull out only the cards that have the number 1 in the bottom corner. And we're going to do the same for the antibiotic cards. So we have a little smaller set of cards for a smoother running game for just 2 players. Both decks are shuffled. And there are going to be 4 cases laid out. These cases, as well as the top of the infection deck, are available to be treated at any time. You can see we have cases ranging from 2 points to 4 points in score. Some require oral antibiotics, some require IV antibiotics. I should say IV or IM antibiotics. Each player is dealt 5 antibiotic cards to start. And we'll start with this player. Let's see what they have. So they've got some options here. Let's say they see, trichomonas, they have metronidazole. They will play, on each turn, they have the option to attempt to treat 1 infection case. They don't have to, but they may attempt to treat 1, and they will draw 1 card at the end of their turn. So they'll play 1 card saying, I think I can treat that successfully. Flip it over. Yes, they're correct. They will take this card and reserve the card for later. So now they've scored these points, and they will score 3 points at the end of the game. Metronidazole, this card is done. It's discarded to the discard pile, and they draw a new card to their hand. Moving on to the next player. They've got a couple special cards that we should know about. Observation, certain infections do not need to be treated with antibiotics. They will use this card if one of those cases comes up. They've also got a wild card called Call Pharmacy, where they can name any infection that they want to. They can name any antibiotic that they want to be able to treat an infection. So let's say they have azithromycin, and I see acute chest here. That's a high scoring one. So they're going to say use, and sometimes this happens, you have to use more than 1 card. There's an oral and an IV antibiotic for this. So they'll use azithromycin as an oral antibiotic, and they will say ceftriaxone with their wild card. Flip that over. For acute chest, the treatment here is ceftriaxone, azithromycin. They score 6 points. Now they've played 2 cards this turn, and they've scored 6 points, but they always just draw 1 card to replace that spot in their hand at the end of their turn. Going back to the first player, let's say maybe they're going to get something wrong here. So they're going to try to treat cellulitis with ceftriaxone. If that happens and they have an incorrect match, penicillin, cephalexin, Clinda were the correct answers, they keep their antibiotic. This card flips back, and now everyone knows the correct treatment, and they draw 1 card. Going back to our second player here, who's already pulled out ahead, they see, rhinosinusitis, 45-year-old, 2 days of fever, they've got headache and purulent nasal discharge. This patient is not meeting antibiotic criteria. They will use the observation card. That will successfully treat it. Observation is special in that it scores points on its own. So they will score 2 points for treating rhinosinusitis and 2 points for observation. So unlike the other antibiotics that are discarded once they're used, this card is reserved. And once again, they will draw 1 card to replace that spot in their hand. We'll go back to our first player now. They're gonna treat community-acquired pneumonia here. It requires 1 injected medication. It's an unvaccinated 4-year-old. Take a look, ceftriaxone is the correct treatment. They're gonna score these points. We'd been taking from the top of the deck only there before, but as we treat infections that are in the middle there, the card just gets replaced from the top of the deck. Discard the antibiotic card, draw to refill the hand, go back to the next player. This is a card, there's a number of cards that have 2 options. This can be played as ciprofloxacin or levofloxacin. You don't have to declare it when you play, but there's a patient with rhinosinusitis who is allergic to penicillin, so we'll try levofloxacin for that patient. Levofloxacin is correct. They score these points. Antibiotic is discarded. Replace the infection and draw a new card to their hand. So players are just going to take turns treating infections. Cards will disappear and be replaced, disappear and be replaced. And eventually we're going to get to the point where there's nothing left in the deck. When this last card is played out and the deck is empty, that's when the game ends, and they will add up the number of points that they have scored to see who has won the game. And remember that observation card scores some points.